Following the National Mental Health Commission's recommendations and the subsequent support of these recommendations by the Australian Government in 2015, PHNs around Australia have been developing mental health stepped care models in line with this nationwide reform to deliver more flexible mental health services. So we're continuing to fund mental health services, but in a way that's more responsive to the needs of the individual. Stepped care is an evidence-based and staged system of care that includes a range of mental health interventions from the least to the most intensive and matched to the individual's needs. Our mental health stepped care model is a consumer-centred model that's tailored to each individual and integrated with physical health and social services with an emphasis on recovery. The model is for all consumers, from young people to seniors. Our mental health step care model keeps GPs at the centre of the consumer's care and ultimately aims to improve outcomes for consumers with mental health issues in our community.
When we talk about growing the mental health of our nation, new mental health stepped care models are key. Stepped care in mental health is user-centred rather than provider-centred. It's about putting people and their families at the centre of their care. Stepped care has an emphasis on collaborative care, team-based approaches, putting the person at the centre of their care while maintaining an important role for the person's GP and other health providers. Mental health stepped care is about shifting the focus of care towards earlier intervention for people with their mental health problems, emphasising recovery. By responding earlier, people's mental health difficulties are less likely to become chronic and severe. They're therefore less likely to use hospitals and more intensive-based interventions at a later stage. Using information about a person's individual levels of need when they're presenting for care, their current symptoms, how they're functioning, their current mental health problems allows us to categorise their disorders into clinical stages. Based on the clinical stage, mental health support options can be matched precisely to the person's actual needs. For example, a 15-year-old dealing with depression for the first time requires quite different supports to a 40-year-old who has chronic depression, alcohol abuse and lots of other life difficulties. Having a good understanding of a person's needs and their recovery goals ensures care is more personalised and tailored. It ensures that people get the right care at the right time, the right level of care. Mental health step care involves a holistic or whole of health approach. Mental health issues rarely occur in isolation. Mental health care, step care addresses not only a person's mental health needs, but their physical health, alcohol and drug issues, other family and social areas, and most importantly, their level of functioning. Are they in education or employment? To provide more personalised care, you've got to do this at scale, not just for one, but for lots of people. That's why mental health step care includes eHealth technologies, new apps, new web-based systems, new digital technologies that allow us to assess, monitor and closely follow outcomes of care. We are in a period of great change in mental health service reform in Australia. PHNs now play a central role in service development. Regionally, they bring together the local perspectives, funding streams and governance so that people in your area get the right care at the right time.
Eastern Melbourne PHN is transitioning to a mental health stepped care model. The model emphasises collaborative care with a care team approach that includes working closely with the GP to ensure the patient's overall well-being is managed. Patients of all ages who live or work in East Melbourne PHN's catchment who are not able to afford or access similar services are eligible to be considered for East Melbourne PHN's mental health step care model. The patient's needs will be assessed and service will be offered matched to their level of need. The mental health stepped care model will comprise a varied workforce, including psychologists, mental health nurses, social workers, occupational therapists and peer workers, among others. There is an expectation that clinicians utilise their skills to their maximum. For example, patients with moderate to high level mental health needs may be seen by a credentialed mental health nurse for clinical care coordination, while clients with low to moderate need may be offered a different suite of services. Tom is a 32-year-old and works part-time. Tom goes to his GP reporting that over the last few months he has noticed that he has been feeling on edge and nervous. He is finding it hard to do the things he normally enjoys and reports he has no motivation. He isn't sleeping well, waking often at night, unable to get back to sleep at times. In the last few weeks, he has also noticed he is struggling to concentrate. Tom has been trying to manage this on his own, thinking it will pass, but he has been missing too many days at work. He has stopped catching up with his friends on the weekends and is concerned he has started to drink a little more than usual. Tom's GP determines that Tom is help seeking, with mild to moderate mental health symptoms, and is experiencing impacts on his functioning, including social and occupational. This indicates that Tom is likely experiencing Stage 1B mental health problems. Based on this information, Tom and his GP discuss a range of available mental health support options matched to Tom's needs. They decide to initially try early intervention and digital mental health support options such as online support groups, forums, chat groups and apps, with a 2-week follow-up with his GP. At the 2-week follow-up, Tom reports a small decrease in his symptoms, stating the websites and forums have been helpful. However, while he is feeling better, he doesn't feel like his old self and continues to miss work and is avoiding his friends and usual activities. Tom and his GP consider options for medication, and Tom's GP refers him to his local East Melbourne PHN funded mental health stepped care model provider for consideration for psychological intervention. Tom attends a mix of individual and group supports over the next 6 weeks. At his next appointment with his GP, Tom reports a significant improvement in his mood. He has reduced drinking and hasn't missed any work. He feels he will continue to use the online forums and supports, and feels that with the things he has learned and the small lifestyle changes he has made, he is able to cope better. Anyone can refer to the model, including GPs, private psychiatrists, allied health professionals, mental health nurses, schools, social services, and patients and carers. When a patient is identified as requiring the support of multiple services, service providers should come together with the patient and carer where relevant to establish agreed working practices and develop a collaborative care plan. The collaborative care plan will promote a shared understanding of the patient and their personal recovery goals, promote consistency in practice, avoid duplication of care, and ensure all care team parties are working towards the patient's identified goals. Consent, confidentiality, and appropriate information sharing are central to a recovery-orientated collaborative care plan. Maria is 45 and was diagnosed with schizophrenia when she was in her mid-20s. She is having difficulty with her psychosocial functioning and has recently reported experiencing social anxiety, resulting in her rarely leaving the home. Maria has difficulty with motivation, and as a result she's not managing her activities of daily living and has been struggling to maintain the upkeep of her flat. Her nutrition and general health have also been impacted. Maria describes feeling very uncertain about her future and how to make her life meaningful. Maria is frustrated about the side effects of her antipsychotic medication and has been thinking that she would be more motivated and able to do things if she ceased taking it. Maria's GP considers her current level of symptoms are significantly impacting on her functioning and believes that Maria is likely experiencing Stage 3 mental health problems. Maria's GP, in consultation with Maria, refers her to a psychiatrist for a medication review and a discussion about the side effects and options. Maria's GP also makes a referral via East Melbourne PHN's referral and access team to the mental health stepped care model for consideration for clinical care coordination with the mental health clinician. As part of the clinical care coordination, Maria's mental health clinician regularly monitors her risk, mental state and how she's managing her medication. Her clinician also offers mental health psychoeducation and support and suggests strategies for managing her anxiety, including relaxation and mindfulness. In consultation with Maria's GP, Maria's clinical care coordinator and Maria agreed to link her in with a dietitian and to receive support from her local council to assist her with house cleaning. Maria's GP continues to manage Maria's antipsychotic medication and monitors her physical health. Maria also commences work with a peer support worker as part of the mental health stepped care model, who provides Maria with social support and helps her to join a local mental health peer support group, which she finds very helpful. As there are a range of services involved, it is important that there's a collaborative and integrated approach to Maria's mental health care and support needs. Maria's clinical care coordinator works with Maria, her GP, and all other care team services involved to develop and regularly review a collaborative care plan for Maria. East Melbourne PHN mental health stepped care model offers a range of options for responding to patients' unique needs and ensure the GP works closely with the care team to manage their overall health and well-being. For further information, including help with referrals, contact East Melbourne PHN's Referral and Access team.
To find out more about Eastern Melbourne PHN's mental health stepped care model, visit our website or contact our Referral and Access team.